Hi, it's Christina Wang, and on behalf of the American Society of Retina Specialists, I'm reporting from the annual meeting in Boston. It's my pleasure to be joined here today by Dr. Mauricio Maia. Dr. Maia is an associate professor at the Federal University of Sao Paulo, and he is here speaking about his phase 1 trial results, looking at a new dye based on anthocyanins from the Açai fruit for chromovitrectomy. So first of all, Dr. Maia, thanks so much for being here today with us.
It's a pleasure for me to be here with you.
So coincidentally, I just had an Açai fruit bowl for breakfast this morning. Are we talking about the same type of fruit for vitrectomies?
Yes, actually it's the same type of fruit. The Açai fruit is compounded by many anthocyanins, which are the basic component that stains the intraocular tissue. So it can also be found in blueberries, berries, all the purple fruits, okay? And we started this study actually because we think this kind of dye may have potential advantages as we have nowadays in the market.
So tell us about the results of your phase 1 trial. Were there any safety concerns?
No, actually, we didn't observe important safety concerns unless one patient that had some inflammatory cells at the anterior chamber that we observed at 1 week, and after that, after some eye drops, this inflammatory reaction, very mild, disappeared. So we did not observe any kind of problems in this clinical trial.
And what retinal elements are best stained by the anthocyanins? Is it ERM, ILM, hyaloid? And second part of the question, how does this class of dyes compare to our more conventional stains like triamcinolone, ICG green, brilliant blue?
Christina, we have 2 basic intraocular structures, very important during vitreoretinal surgery, that may be stained by this dye. One is the posterior hyaloid. Nowadays, all over the world, we use triamcinolone in order to do that. So this is the first intraocular structure, very important. The second one is the internal limiting membrane that we use nowadays, two dyes, or the indocyanin green, the ICG, or the brilliant blue, which is worldwide more used than ICG. Actually, both structures are very well stained by this kind of dye, so we believe it may be very helpful for vitreoretinal surgery using just one dye to do all the jobs inside the eye, you know?
That would be great. And last question, what type of processing and purification does this type of dye need to undergo before we can safely use it in the eye?
Yeah, we have 5 major types of anthocyanins. The major one is the cyanidin triglucoside. And actually, this dye is very acid, so we have to correct the pH to 7, the osmolarity to 300 milliosmoles, and the density to 1.1. When we do that, we inject this substance inside the eye. It goes through the posterior pole and stains very well the posterior hyaloid and also the internal limiting membrane, which is very good. We think there are 4 potential advantages of this dye in comparison to the other dyes. One is to stain both structures. The other one is that is heavier than water, so you just leave inside the eye, it goes to the posterior pole. It's not necessary to perform a kind of jet stream, which is very dangerous for the retina because it's neurosensory tissue. The third benefit for the patients, what we believe it's very important, is that it may be, we're not sure about this yet, but it may be more, it may be safer than the other dyes that we have in the market because of the antioxidant effect. We're studying this in cells which is very important study too. And we believe the singlet oxygen, which is released after light irradiation using any kind of dye, may be quenched by the anthocyanins. So we believe these are the three major advantages. And the four major advantages that we believe is that it may be for sure cheaper than the other dyes in the market.
Well, sounds like great qualities. We're always looking for a new stain that we can use to enhance our surgical procedures. So thanks for sharing your insights on this one that we potentially might be able to add to our collection in the future. Thanks, Dr. Maia, for being here today. This is Christina Wang reporting for ASRS Updates from the Field.